after I was diagnosed, I met with my breast surgeon first, and he talked to me about a mastectomy coming, in the future. But we actually started with the doing chemotherapy first to see if he could shrink the tumor and perhaps save my breasts. I wasn't very optimistic about that happening because I'm actually very small-breasted, so it would have to shrink down to microscopic to leave me with anything.
Originally, when they first did my first biopsy, they said, okay, we think, you've got a big lump. It was probably about 5 centimeters, so it was large. But we might be able to do a lumpectomy. I could handle a little divot in my breast, and I thought it was just going to be a lumpectomy, and radiation was a lot easier, but I do have to admit, once I found out I was going to need a mastectomy and chemo, I was a lot more upset. Sorry.
I was like, okay, yes, I'm not gonna really be a breast cancer, a cancer girl. I'm gonna, get it taken care of and be on my merry way. And it turned out to be a lot more complicated and a lot longer than that.
When I brought up mastectomy with a breast surgeon that I was seeing, he sort of, he said, you're single, you're really young, you don't want to do that until you're married. As a woman who's not been diagnosed with cancer, doing a mastectomy prophylactically, I have a lot more options than I would if I had already been diagnosed with breast cancer, and can pretty much make an aesthetic decision.
I just had my second to last reconstructive surgery, which was one of 11 surgeries so far. I have one more to go.
So I did have to have radiation, which then changed all my reconstructive options. Previously, I was just going to have an expander put in with an implant, and I just 3 weeks ago had the lap flap. So I'll be 2 years as my anniversary in December, and I'm still finishing the process.
There were a lot of doctors who said, you're going to die if you don't have this surgery. And so I said, okay, I need a new doctor. So I kept researching and finding new doctors until I found those that were a good fit for me. And when I ultimately ended up having to have chemo, I traveled to Evanston, Illinois every 3 weeks to do holistic chemotherapy with vitamin infusions and Reiki and light therapy and vegetarianism.
Even though I'm 4.5 years out, I still have obstacles. I still deal with side effects of my treatments and of the surgeries, and you still have follow-ups because I had such a rare form of breast cancer. So I'm never free of it.